there are a lot of challenges that he or she faces in healthcare. So, what, according to you, in your experience, are those major challenges faced by people?
Yeah, I think knowledge is one key challenge, right?
Yeah, hi Sandeep. How are you doing today?
I'm good, thank you. How are you?
I'm great, great. So before we start the discussion, let me set the context and base of the session. So we'll be talking about why is preventive healthcare so much important in today's day and age, right? And today we have Mr. Sandeep, who is co-founder uh, of Carebyte, right? So before we start today's discussion, I'm curious to know more about your journey. So if you can shed some light over there, it would be great. So how the journey of Carebyte started and how it has been so far.
Yeah, sure. So would you want a little bit of background about me, Mohit, first? Would that
That'll
help?
be great. That'll be great.
Awesome. So despite being born and brought up in the UK, I actually did my medical degree in India. So I graduated in India in Manipal, right? And that's when I really started to understand the Indian healthcare system. This is back in between 2004 and 2010. Right.
Okay.
Now, Manipal is a private medical school and setup. And because I'm used to the UK's government sort of healthcare system, what I wanted to do is understand how the government system runs in India. So I came back to Delhi, which is where my family's from, really, yeah. And I worked in a hospital called Hindu Rao Hospital, which is a very busy sort of government hospital in Kamlanagar in Delhi.
Okay.
And that was a humbling experience. It made me really realize that what we have in the UK NHS is quite amazing, for free, right? In Hindu Rao, I used to see in 60-bed wards, I used to see 120 patients, 150 patients on those beds, right? Came back across into the NHS and did 5 years of clinical medicine here, where I did a master's in pediatrics and I did family medicine training from Oxford. And during that journey as well, I helped build up my family's nursing home business during that time. And I started a startup which was solving communication problems in the NHS, which is partnered with British Telecom and Samsung. But the real challenge that I see more globally is, 2 out of 7 people in the world live with chronic disease like diabetes, heart disease, cancers, right? And most of these are preventable, right? But India alone, for example, is going to have another 100 million diabetics in the next 9 to 10 years, according to the WHO, right? And we've got great treatment modalities when we get there. You've got insulin, you've got great sort of methodologies to manage kidney diseases if they happen from complications of diabetes. And medical science has moved on a long way, but we're not asking the question, why are we going to have another 100 million diabetics in India in the next 9 to 10 years, right? Yeah. So what that literally means is, 1 in 10 people that you and I know in India will have diabetes in the next 9 to 10 years, right?
Right.
And that's quite scary, right? Yeah. So that's why Carebyte really, the fruition of Carebyte has started with that thought. Another problem that we saw in the Indian healthcare system is, if you leave aside Ayushman Bharat, those individuals that are covered by Ayushman Bharat in terms of insurance, then only 15% of the Indian population has any health insurance, right? And what that means is 55 million people go into poverty every year because not being able to pay out-of-pocket expenditure on healthcare. And of course, we saw a lot of that during COVID, right? I saw some of the hospital bills that came about due to this, right? And it was mind-boggling numbers, and people couldn't afford it, right? So I think getting a deeper penetration of health insurance is really, really critical to making sure that we can deliver the next generation of healthcare to individuals.
Correct. Correct. That's great. So you touched upon this a little bit, but however, I would like to understand, like, can you give me the overview of the industry? Like, what is the industry size and the healthcare market in India, and how mature is Indian market as compared to, we compare other markets in the world out there?
Yeah, I mean, from a maturity perspective, I think the Indian healthcare system is just really kicking off, if I'm honest. And I combine not healthcare, just healthcare, but healthcare and insurance. I think it's just starting off, and it's not very mature at all. It's a very reactive sort of approach, and you see that in consumer behavior, right? So only once they get a real problem do they approach the doctor or the clinician, right? Whereas if you an example of that is, as a doctor, the kind of patients that I used to see, right, would have really advanced disease before they would even come to me, right? And by that advanced stage, there's nothing that we could really do as clinicians, right? Yeah. Whereas in the Western countries, actually that education level about actually when to see a doctor or when to see a healthcare professional, they're seeing them much earlier on in that journey. So that actually some interventions can happen, much earlier. Does that make sense?
Right. So that's where the timing of identifying or identifying the disease can do a lot of great things, right, over the period of time. So now, again, that brings me to my next question. Like, what are the key driving factors for the industry in India, particularly?
So some of the key driving factors will, of course, be the insurance and getting the insurance sort of coverage across individuals, right? And some of those payment mechanisms will become a lot easier. So you're getting cashless sort of OPD, cashless inpatient insurances at the moment, right? How they're marketed to the consumer. At the moment, most of that 15% that are insured through their employer, right? Yeah. So if I'm working at Google, for example, then I've got a great health insurance that covers me as an employee benefit. But what happens when I move away from Google to, I don't know, Facebook in 2 years' time? That health insurance doesn't move with me, right? So I think a lot of consumer sort of insights, consumer sort of behavior will change around how you buy insurance, not just for yourself, but also for your family members, right? We are starting to see millennials who are much more proactive with their healthcare, right? So we are starting to see them following fitness coaches online, nutrition doctors, right? And we are starting to see behaviors towards a healthier sort of lifestyle, which we haven't really seen in the Indian consumer before. Yeah, and I think COVID has exponentially increased that, because it's not just about them, right? It's also about their family members, their loved ones, right? Yeah, we don't want our loved ones to go through those challenges that a lot of people had during COVID, right? Yeah. So I think due to some of these driving factors, we're starting to see actually how behavior is changing towards how can we prevent disease from happening in the first place, because the vast majority that were affected by COVID, who either unfortunately passed away or had some serious morbidity afterwards, right, were those with diabetes or chronic diseases like heart disease.
Correct. So, I believe there are a lot of key challenges which a consumer is facing in the industry today, or if I talk about a common man, there are a lot of challenges that he or she faces in healthcare. So what, according to you, in your experience, are those major challenges that are faced by people?
Yeah, I think knowledge is one key challenge, right? Um, Understanding just about individuals' healthcare and well-being. For example, I just mentioned well-being, right? And that really isn't a thing in India. Mental health is a taboo. In fact, it's not even not a thing. It's actually looked upon badly. Like if you have anxiety or if you have depression, and most of us in this world will go through phases of anxiety, phases of depression in our lives, right? But to talk about these things is a taboo. Yeah. So a lot of education of society needs to happen around this. So these are some of the challenges. Other challenges are, again, behavioral changes. Healthcare takes a long time to show changes, right? So, for example, one of the best ways to reduce your risk for diabetes or for chronic disease like high blood pressure is obviously to reduce obesity, right? To reduce the weight. And there's many studies that have shown the correlation between weight loss and reduction in type 2 diabetes and hypertension and heart diseases, right? But if somebody needs to reduce 10 kgs, that can be a painful journey of 3 months, 6 months, or even a year, right? And to stay dedicated for those 3 months, 6 months, or a year, that takes a huge behavioral change in the mindset of the consumer. Yeah. And what happens is maybe you'll do a crash diet, but after the crash diet, because your mindset hasn't changed, you'll fall back into your old habits. And 70% of people that go into these crash diets bounce back. Yeah. Because that behavioral change at a very primal level hasn't happened. Right. Yeah. So these are some of the key challenges that not only exist in India, that's just human nature, right? Yeah. So these are some of the biggest challenges that I think exist in changing India's healthcare.
So I believe there might be certain steps that you as a firm or Carebyte as a firm are taking in order to eradicate this or to answer those questions. So can you highlight those pointers?
Yeah, absolutely. So, I mean, what we're going in with Carebyte to the consumer is what they understand. Okay, they understand that a doctor's appointment is costs whatever between 500 to 1,000 rupees at this day and age, roughly, in set cities like Bangalore or Delhi, right? Yeah. So what we're saying is you get unlimited access to these clinicians for a subscription fee. Yeah. And you get access to a fitness coach, a nutritionist, and a clinical psychologist, right? Along with specialist care if needed. Now, these people can quantify and understand, because they can go on different apps and different products and add up the cost of these and they get it, yeah? But what we have that's unique is obviously a lot of the processes that underpin everything that we do. If you think about us as a subscription service, right, then the more the user ends up utilizing our doctors and our teams, the less money we make, right, from that user, correct? So our incentive is that they shouldn't need to utilize our doctors or our specialists or our clinicians, right? Yeah. So the only way we can do that and survive as a business is if the processes that underpin this are around those behavioral changes and slowly nudging users towards making better choices in their lifestyle and making sure that we can reverse their risk factors for diabetes or for heart disease, etc. Because if that happens, then they won't need to use our doctors, right? Because they won't get ill.
That's quite interesting model out there. So to be very honest, right? So now that brings me to my next question. Like, what are the key benefits? However, you touched upon this a little bit in your answers earlier, but what are the key benefits of a health concierge?
The health concierge is, I guess, like your constant friend in terms of your healthcare, right? Like I said, healthcare can be a very challenging journey, to see that impact and to stay militant and to create those behavioral changes. The health concierge is there to keep on motivating you on this journey, right? The health concierge is there as your kind of conduit and the hub and spokes to it all. So if you don't need to Google, often we go and Google, for example, what are symptoms we're getting. If we're getting a headache and a fever, we'll Google it. And of course, on Google, you'll start getting, well, you've got cancer or you've got some ridiculous condition, right? So the health concierge will be able to triage you properly and understand actually what might be going on and arrange an appointment with you with a specialist if needed or with a professional if needed, right? So they are almost like the way I liken it is maybe a butler, right? But for healthcare, very specifically for healthcare.
Right. So I believe that, people usually tend to Google a lot of things and then they end up, guessing that, okay, oh, this is this disease and it should go away in like 2 or 3 days, but that really might not be the case, right? So that is where I believe it is very essential to take a professional help and, the person who has knowledge of this, not just the Google search can give you the actual reason of why you are ill or so, right? So that's quite great, and to get that service on your fingertips is what actually a person is looking at, right? And I believe Carebyte has created that ecosystem in which it might be a one-stop solution for all my needs, per se, right? Even if I need just I want to interact with doctor or I need to book an appointment, or how does it go? If you can elaborate a bit on the process as well, then I believe it would be great.
Yeah, absolutely. So the concierge basically, let's say, you've got an individual who's got fever and who's got this headache, right? And the concierge thinks actually you need to have an appointment with your GP, right? Yeah. The GP will do their assessment and they will feed back a plan to the concierge. Now, this plan could involve possibly some blood tests or some diagnostics. It could involve some medications, possibly, or actually it may not involve any of that, but it might involve a clinical psychology appointment or a fitness and nutrition, because some food might not be agreeing with this individual, right? So the concierge can navigate the individual around all of this, so that the individual doesn't need to then go on to a pharmaceutical site to get the medications or to book the lab tests, So the concierge will make that journey in healthcare, which is so fragmented, the individual would have to go to 5 or 6 different places usually to get resolution of this problem, right? But the concierge will make sure that that doesn't happen. And then the concierge will arrange the follow-ups and they'll check in with the individual. Let's say they've been given medications. So every day there'll be a check-in from the concierge to make sure that the medication is actually working, or if it's not working, then the concierge can flag that to the doctor before the time, let's say they've been given the medication for a week and then to review. But at day 3, if the medication is still not working, then actually we can be a lot more proactive and get them booked in again with the GP. Does that make sense?
So it's all about, you can monitor in real time basis and probably physically, if I visit to a doctor, let's say once, then probably I have to set up a visit after a week or so, like you said, right?
Yeah.
But during that week's time, nobody is actually monitoring how those medications are going on, right? So
Exactly.
that's where I like really the concierge can basically come in and give the solution, right? So that's
Exactly.
pretty interesting.
And symptoms might change, or there might be some progress of the disease or of the condition, and that can be all flagged back to our team, who all are aware of what's going on with the individual, right? So yeah, that's the key thing behind the concierge, I'd say.
Interesting. So you mentioned that you have been into this profession. You have worked as a doctor as well in India, right? So basically, in your experience, how has the market evolved over the past couple of years?
Yeah. So I think it's always been reactive. The healthcare has always been reactive, which we talked about earlier, right? So what I mean by that is only when the consumer really, really feels they need a doctor, right? And they need to be checked, only then will they get seen. Now, I think that mindset is starting to change to a much earlier sort of time scale that they're able to go and see the doctor much earlier. But also due to COVID, obviously the market has completely changed in the last 2 years because of technology. Yeah. So obviously telemedicine is kicking in now, right? Or has kicked in a very big way. So that gives access to a lot more people a lot more easily. Now let's think not just in cities, let's think out of cities, right? I know people that used to travel a very, very long way to just access doctors. But to do that, they would have to give up a day's work, right? To get access to these doctors. Now that was a question in their minds. Should I do that because that's my income, and that was a challenge. But now with telemedicine, I think, where the access to these clinicians and to the healthcare professionals is becoming a lot simpler. I haven't really seen a movement towards a proactive model and value-based model, which is what Carebytes really bringing in, so that we actually actively try to keep the individual healthier, because it's not in our interest to have them coming to see the GPs or the clinicians, and it's not in our interest to prescribe the medications or diagnostics, because that's not how we make money. Yeah, we would rather save the individual money. We would rather save them from getting ill in the first place.
So now, where do you position yourself as a firm in the next 3 years, maybe, right? So you have told me that COVID has played a pivotal role in bringing awareness about health in a lot of individuals. So I'm sure this trend is about to grow only, right? And people are educating themselves and they are being health conscious nowadays, right? So where
Yeah.
do you see yourself or Carebyte as a firm in the next 3 years?
Yeah, I mean, in the next 3 years, we hope that we'd be serving a big population, in terms of our care, and they'd be our members. But to us, it's not just about having those paying members. We believe that public health and healthcare in general is a human right. Yeah. And we believe that any organization should be educating the population about healthcare and should be promoting good health. So we'll have a couple of models, one for obviously people that want to utilize our services and want to become paying Carebyte members. That's great. But we'll also have a free model where they can still access our app and they can still access the content just to educate themselves, which might include sort of free fitness videos which they can follow and work on, or free videos on nutritious meals. It's very difficult to come up with meals that are within certain sort of calorific values and with the right sort of content, especially with our Indian diets, right, and Indian palates. Yeah. And also we believe in trying to create that behavioral change. So you'll start to see us maybe bringing out some gamification in our app, where for staying healthier, they might get some rewards basically in our app, right, for staying healthier. And that's, all for free. That's where I see it, because to us, it's about just promoting good health in general, right? It's not just about making revenue or being a revenue generating business. It's how many lives can we touch and promote good health to.
That's quite motivating, I'm sure. So basically, the thing that you are doing is pretty amazing, and I like the part where you say that okay, there'll be a lot of content that users can anyone can see and they can consume it, right? Basically, they can educate themselves on different aspects of these things, right? So that's quite interesting. So I believe that's about it from my end, Sandeep. It was a very lovely interaction, and I personally like what you are doing, and all the very best for that.
Appreciate it, Moya. Thank you so much. And thanks for having me.
Thanks a lot. Thank you so much.